I'm going to demonstrate the perineal care. So, what is perineal care? Perineal care, it is a washing of genital and anal area with plain water for medicated solution. So, purpose: to cleanse the area of secretion and excretion. Number 2, to reduce unpleasant odors. Number 3, to prevent the skin irritation and excoriation. Number 3 is to control the potential for infections and to promote comfort. So, possible nursing diagnosis: altered bowel elimination, altered patterns of urinary elimination, total urge and stress incontinence, self-care deficit, disturbance in self-concept, altered in self-concept, altered sexuality patterns, potential for infection, knowledge deficit. So, equipments with cover, and then waterproof underpad, bath blanket, a tray containing the following: sterile pickup forceps in a disinfectant solution, a jar of dry sterile seaweed, with soup salt solution, a jar of dry sterile seaweed with soup in antiseptic solution, kidney basin lined with paper, 4 wastes, toilet paper, patient supplies, a piece of paper to wrap, vaginal pads, working forceps, adult diaper or sanitary pad, patient supplies. So, the procedure is: number 1, assess the patient, assess the need for external touch. Number 2 is explain your intention. Excuse me, ma'am, I am going to demonstrate or going to assemble equipment to the bedside. And then, screen the patients and close the door or, if possible, in the windows. Then, after that, place the waterproof pad if available. I already placed the water pad in because I have waterproof pad. Then, change the top sheet with bath blanket. And then, drape the patients with bath blanket to permit exposure of the genital area. Okay. And then, this rationale is the midwife provides warmth and is respectful to the patient's modesty. Number 9 procedure is don gloves and places the patients on a bedpan in a dorsal recumbent position. The rationale of this: a bedpan with collect and water used during perineal cleaning. Number 10 procedure, leave the cover of the flushing can and fold the sterile side inside. Test the water. Assuming there is a water for perineal. Lift the cover of the flushing can and fold the sterile inside and test. Then the temperature by pouring over the back of the hand. And then on the patient's thigh. Ilang ma'am? The rationale of this is water dissolves or dilutes dry secretions of emulsifies fatty substances in the skin and reduces the ability of the microbes to grow and multiply. Then flush the area with warm water on a dry soapy solution until the area is clean. Then with the cotton balls, and clean up. Number 12 procedure is, then with the cotton balls, soak in subside solution, wash the mons bed, the wrist, and lower abdomen. Washing is begin at the upper aspect of the labia majora. So prepare the 7 cotton. 1, 2, 3, 4, 5, 6, 7. On the labia majora, and continue upward towards the umbilicus. And then, number 13, use a second cotton substance solution to wash the inner aspect of the farther thigh, beginning in the crease of the groin and continuing outward toward the knee. These strokes are made with a back and forth motion and are carried well underneath of thigh. And then the third cotton is used in SSS to wash the inner aspect of the nearer thigh using the similar stroke. And then the fourth cotton ball in SSS is used to wash the farther labia majora in zigzag stroke toward the given labia. And then do the same on the other labia. And then the 6th cotton ball in SSS is used to wash with downward stroke from the clitoris, meatus, vaginal opening to the perineal, and lastly the 7 cotton balls is used to the SSS and to include the anus. And then rinse with sterile water and pat dry using the toilet paper. The rationale of this is moisture supports the growth that microorganisms and contributes to discomfort. And lastly, remove the patients from the bedpan, turn the side, and dry the buttocks. Excuse me, mom. And lastly, last procedure, and put some diaphragm or sanitary pad the performance of the procedures and objectives and subjectives findings and the patient's response. Written information documents the individualized care of potential. And that's all about my perineal care for today. Thank you.